Hi, my name is Dr. Matthew Yakimov and welcome to this short introductory series on preclinical intraoral radiographs. We'll start by talking with you and showing some of the equipment you'll need to be using and then move on to demonstrating the various techniques. There are two types of mannequin that you're principally using in the clinic, which we'll refer to as Dexter type 1 and Dexter type 2. This is a Dexter type 1 mannequin. It's designed to replicate the maxilla and the mandible and the hard and soft tissues required in intraoral radiography. It's quite simple to operate. There's a simple lever here on the top of the head. Take a hold of that and pull on the handle, draw back towards the back of the head and you'll be able to close and release like so, and just reverse the process in order to open. This is a Scannex phosphor plate, the type that you'll be using in the clinic for both your training and for actually treating patients. As you can see, it consists of two different sides, the blue image receptive side, which you can see a radiographic marker for, and the back non-image receptive side, which has the details here, including the size number. We're principally using size 2 for this training, and that's the size film we use most commonly in the clinics for adult radiography. It's important to note that these films cannot be placed directly into the mouth, as that would contravene infection control standards. We actually place them into these envelopes when we're utilising them in the clinic. I'll show you now how we put that together. Just a reminder that this is the non-receptive side of this information. It says opposite side towards tube, and this is the sensitive image receptive side. This is the side facing towards the tube head. The envelopes have a transparent clear side and a black opaque side. We want the image receptive side to be adjacent to this black opaque side, protecting the plate from any premature exposure. How we put that together is that we open the envelope, place the film in so that the writing is visible through the clear transparent side. Then you'll see this white strip across the top. Simply peel down the strip, peel off the protective paper and seal the adhesive together like a letter envelope. These are the main types of radiographic holder that you'll be using to practice these techniques. This is an index Bitewing holder for the first technique, Bitewing radiograph. These are two styles of holder for parallel periapical radiographs. We have an anterior holder and a posterior holder, green and red, which we'll demonstrate later. These utilize the ring attachment. And this is called a snap array holder, which we'll be using to demonstrate the bisecting the angle technique. We'll start by showing you the components of the X-ray machine itself, starting with the tube head and long cone device, which you'll need to position to whichever spot is required for the technique that you're taking. Then moving on from there, we can see a series of connecting arms, which takes the machine up to the ceiling. Across from here down to the power source, which you'll see has an attached control panel. The main components you need to be aware of as a student are the three settings shown here, going from speed, milliampere seconds, and the kilovoltage peak. You can adjust these by selecting the mode button, like so, and then adjusting as necessary with these buttons. In order to actually take an exposure, you will need to press and hold this button in the center here. You will see this light briefly flashes and you'll hear a loud beeping tone. Do not let go of this button until you hear the end of that tone, otherwise you'll get an incomplete exposure. Once you've confirmed that you're happy with the settings on the machine and the way things are positioned, you'll now need to leave the operatory along with your assistant and anyone else that is not the patient being exposed, like so. You will then need to loudly announce to anyone else in the surrounding vicinity your intention to take an X-ray by calling out something as simple as X-ray very loudly. Make sure everyone's acknowledged, make sure no one else is in the field of view of the film itself, and now take the image. If you don't hold the button for sufficiently long enough, you'll get this error message, ER00, indicating that an incomplete exposure has taken place. You'll need to re-perform the radiograph. Before you can do so, you'll need to reset the machine to get rid of this message. In order to do that, you can operate the power switch, which I'll demonstrate to you now. Just underneath the power source here is a little black dial. You can press that until the machine goes blank, reactivate that, and just wait for. Let's start by talking about the Bitewing radiographic technique. Remember that we take a Bitewing principally to image the interproximal contacts of posterior teeth for incipient caries and to have a look at the alveolar crestal bone heights. Let's go ahead and show you how to take one for the left-hand side on this particular mannequin. So remember, we need to use this indexing Bitewing holder. You can see that we have the arm, the index, and the attachment for the film itself. I'll show you how we put that together now. So using one of the films that we've already previously assembled, we now need to take this, remembering that the image receptive side is on this black side, gently pull this apart a little bit. As you can see here, it's also written with X-ray and indicating the direction of the X-ray. Place this into this little slot, a bit easier said than done. Remember to push it all the way down. And also remember that the bite wings, we need to have the radiographic marker facing towards the anterior of the mouth to help with orientation of the film. Once you have that assembled and you're happy with the way it looks, we're now ready to position this within the mouth. Make sure that the mannequin is in that open position we talked about earlier. We're going to go ahead and place this in there so that the film sits within the lingual sulcus, between the teeth and the dentition. We want this protruding arm to be out and away from the patient's face and not like so. As you can see, it doesn't allow it to be positioned correctly. So, as we discussed, go ahead and place the film in there in the posterior area, again between the tongue and the teeth, and sit that down. You can now relax the tongue like so. You will see that the occlusal surfaces of these teeth are now resting against this bite plane, which will help you stabilize it. Go ahead and gently and slowly close the mannequin's mouth together, ensuring that the film does not become displaced or distorted. We can now briefly check that that's nice and stable. Remember that if you need to, in that open position, you could have brought this a little forwards and backwards depending on which teeth you're trying to image. We're now ready to position the tube head. Now we want to align this aspect of the tube with the index here. And remembering that we're trying to maintain 10 to 15 degrees of positive angulation as shown on the dial here. Keep in mind that sometimes these two horizontal planes may not exactly correspond depending on the occlusal plane of the patient. Let's talk now about taking parallel periapical radiographs. We'll be using these holders as we showed earlier. The first thing we need to identify is that there is a holder for the posterior of the mouth and a holder for the anterior of the mouth. You can see that both it's written on there, posterior and anterior, and it's color coded with a maroni red color and green for the anterior. You can also see that with these holders they are a bit more adaptable compared to the bite wings that we showed earlier. If you actually turn onto the side-on view, pull this forward a little bit, you can have this swivel in place like you can see here. This allows you to adapt it for different quadrants of the mouth and for the maxilla and the mandible. We'll demonstrate that shortly. You can also see for this holder that there's a bite plane, it has a ribbed appearance for the anterior, and for the posterior it's more like the bite wing holder we showed earlier. There's this flat plastic plane here too. There's also this protruding arm which extends out of the mouth. Unlike the bite wing holder, we do use the ring attachment to help you collimate the X-ray correctly. I'll show you now how we can put that together. You'll see that this circular cross-section passes along this circular path here as well. We need to line up a little notch in the ring with the groove on the side here. You'll find that as you make your way along, it now branches into one of two positions, either up like so, which is the correct position here from this instance, because you can see that our film will be sitting in here centered around the ring. You can see though that if you're not careful, it's possible to place it into this second position, which is incorrect. This would result in cone cutting occurring. However, if you needed to take an image on the other side, this is the instance when we would use this little swiveling action, and now this would be correctly set up. As we discussed earlier, these holders have one of two settings. You'll see that the way this is set up here is actually suitable for taking images in quadrant 3 and quadrant 1. Therefore, if we want to take images in the other quadrants, that's when we now need to gently rotate this, readjust the ring attachment, as we talked about earlier, into this position, and now you'll be able to take an image in quadrant 2 and quadrant 4. We'll show you now how to set this up for an anterior image for the maxillary incisors. Remember again that we need to place the film in a portrait orientation, and another important consideration for periapical images is that we want the radiographic marker to be towards the coronal portion so that it doesn't obscure any of the desired apical detail. So in order to set this one up correctly, we will take the receptive side, place that into here, remembering that the A marker is going to be towards the incisal edges, the coronal portion of the tooth. So gently, you'll see there's a little flap here that you can very gently open up. Try not to be too forceful with that, as you can cause very easily damage to the holder. Position the film in the center so that, again, you can see it's pretty well centered within the cone here. That way we're not going to have issues with cone cut. Once we're happy with that desired setting, again, make sure the mannequin's in the open position. You will need to place this far enough back into the mouth that the film does not become bent or distorted when you're positioning it in order for it to be a true parallel image. So typically with students, they place it a little bit too close to the teeth. Don't be afraid to get a bit further back. We will now use this ribbed section to have the incisal edges of this dentition on the maxilla bite onto here. And you will soon see that the lower incisal edges will bite onto the corresponding plane here. So, if we very gently bring this closed, ensuring that things are nice and still and stable, that the film has not excessively moved or repositioned, and that the ring is not too close to the patient's face to cause distortion. You want it to sit a little bit, well, as close as we can, but nice and passive like so. We're now ready to position the long cone device. We can now position the long cone device to the ring as we've established earlier. It's a bit simpler than what we did with the Bitewing. We're just literally having this circular section correspond with the ring on the radiographic attachment. Once you've taken the image, just stabilize the holder in place, gently open the mouth and remove everything as it's attached. It's a very similar process for imaging the mandibular anterior teeth, only you need to account for the tongue. So go ahead now and reposition the tongue on the mannequin, just like you'll have to do possibly for your actual patients. Position the film holder with film in the mouth, ensuring again that the film remains nice and parallel and unbent, and close it together as we described earlier. We'll now demonstrate the posterior technique for a paralleling image. Remember that we need to place the film in a landscape orientation compared to the portrait we just demonstrated. So position it like so, remembering to keep the radiographic marker towards the coronal portion of the tooth. Now, we'll start with quadrant 3. Again, just gently reposition the tongue. Place the film into the lingual sulcus area and position this blighting plane against the occlusal surface of the arch in question. Try to center the film over the area of interest. And we can now very gently again just close the mannequin together. Bring your ring attachment in. Again, not so it's pressing too excessively against the face and not too far away. Something like that. We can now position the long cone device in the tube head. Remembering that for the mandible, we'll typically have more of a negative angulation, and for the maxilla, a positive, just to compensate for the occlusal table. Again, just position the ring of the long cone device against the ring of the attachment as you've correctly set up. So now I'll show you how you can set it up very quickly to take an image on the maxilla on the same side. You just need to open this up as we described earlier, bring this out. We would obviously be replacing the film in this instance because this is exposed, but for the exercise we'll leave it in place. All we need to do is rotate that around as we talked about earlier and bring the ring back a bit, slide it back up into this upper position, and you'll see that we can now position that up into the maxilla, close things together much the same way we described earlier, and image the opposing arch. We will now describe the bisecting the angle technique. As you'll be aware from your lecture content, it's not always possible to use a paralleling technique, although it is desirable to try and use that when possible. But sometimes patient anatomy and circumstances do not allow for that. In these circumstances, we need to employ one of a couple of methods. Either we will use this snap array holder, which has anterior and posterior attachments for the film, or in the clinical environment, we would ask the patient to stabilize the film using their finger. As you'll see, our mannequins do not have a finger. In the training environment only, we'll simulate the action of the finger utilizing blue tack, although you obviously cannot use blue tack in your actual patients. In the bisecting angle technique, we need to be aware of the long axis that's formed by the teeth in question that we're trying to image, and the long axis of the film itself as we've positioned it into the mouth. Between these 2 points, there's an imaginary bisecting plane. We need to position the long cone of the tube head device to run perpendicular to this plane. We'll now show you how you would set up the snap array holder to take a bisecting angle periapical radiograph of the maxillary incisor teeth. Take the film in the envelope as we've set up earlier, all the other demonstrations, remembering again to keep the radiographic marker facing towards the coronal portion and not obscuring the apical detail. We will use, in this instance, this anterior region of the snap array holder, which is the blue rubbery component, which is a little flap here. You need to carefully place that in place, bring that back a little bit so that it sits into place like shown. Make sure that's relatively secure and not easily displaced. Once you've set that up, make sure your mannequin's in the open position. And we need to remember now that we're not trying to place the film in a parallel manner as we did earlier. We're going to go ahead and seat that into the mouth. We are still ensuring that the film does not become bent or distorted when it's placed up against the palatal vault in this instance. Once you're relatively happy with how that's being positioned, in this instance we're going to try and capture all 4 incisal teeth on the maxilla. We gently close the mannequin together, much in the manner we did earlier. Only now you will notice that the lower incisal teeth are incising against the bottom half of this bite block section. We're now ready to place the long cone device in a way that it runs perpendicular to the imaginary bisecting plane. As you can see, the bottom of the long cone device should run along with the ala tragus line. We'll now demonstrate for you how you can adapt this holder to image the lower incisal teeth. Open it as we did earlier, replacing the film with a brand new film. Go ahead and position the tongue in a way that it's comfortable to now seat the newly set up film holder. Placing it in a way that the film does not become distorted or moving about as you do so. The patient can now relax, or the mannequin can. We now gently close this together, much the way we did earlier, until it's nice and stable, with the maxillary incisal teeth biting against this edge of the holder. Now we're ready to position the long cone, like so, keeping a negative angulation here on the mandible, and remembering that we are positioning this so that we are running perpendicular to the bisecting angle line. For posterior bisecting angle radiographs, we can use this end of the snap array holder, as shown. We take the film, we position it like so, with the image receptive side facing towards this bite plane. Seal that together, and now bring this little latch down, locking that into place. Make sure it is nice and stable. You can also see from this side that you want this little clipper to actually be biting onto some of the film to keep it stable. If it's only biting onto the envelope, it'll be very mobile. We'll now show you how you would take a bisecting angle image using this holder in quadrant 2 posterior. Making sure again the mannequin's nice and open. We position the film and holder like so. The occlusal plane of these teeth will be biting against this rubberized biplane. Keep that nice and stable. Gently close it together. And once again, we now need to position the long cone device to correspond with the bisecting angle plane that's been created, making sure that it runs perpendicular to that. We'll show you now how you can easily set that up to take the contralateral side and the lower. Go ahead and open the mannequin. Again, just reposition the tongue as needed. We will place the film into the lingual sulcus, adjacent to the teeth. Can be a little tricky. Like so. Gently close the mannequin. And again, we need to position the long cone to run perpendicular to the bisecting plane we've created in our mind. An alternative method of taking anterior bisecting angle radiographs during the training is using blue tack as shown, remembering that this is simulating the action of the patient's finger in the live environment. Apply it as is necessary, position it into the mouth. In this instance, we want the edge of the film corresponding pretty closely to the incisal edges, and making sure not to crush the film while positioning it. You're now ready to take your bisecting image. One tip regarding a problem you might sometimes experience is that you will find when positioning the tube head, there can be a bit of drifting that occurs like that, which is very frustrating when you're trying to position it correctly. The important thing to keep in mind in that instance is it's often this horizontal arm on the connecting structure that you need to reposition in order to make it more stable. I'll show you now in this instance, if we just move this back even a little bit, you'll find when positioning the tube, it's now much more stable. You'll need to adapt that depending on which quadrant you're working on and potentially which chair you're sitting at as well. The second style of mannequin we have, which we'll refer to as Dexter 2, operates a little differently to that which I've shown you earlier. Instead of there being a lever operated on the top of a head, you'll need to come around to the patient's left-hand side in the rear here, and you'll see there's a zip. When the zip is up like so, you will expose a little thumb screw here. If you turn this in an anti-clockwise direction, it'll gently loosen that screw and allow this to run along the rail, shown here. And this allows you to open and close the mandible of the model like so. So if we bring that all the way back, we're now in an open position. We can now turn this very gently in a clockwise direction, just to tighten it a bit there and to secure it in place, maybe a little bit more than that. Be careful not to over tighten as it can come lock in place, and do not over loosen it as well because it can fall off from the track. Once you've taken your radiograph, you will need to remove the radiograph from the protective envelope we had earlier. Remember that in the actual clinical environment, you would be wearing gloves as this would be a contaminated surface. You would need to open this and then have your assistant with clean hands grasp onto the film and remove it from the contaminated envelope without contaminating the film inside. For the training though, we'll show you how we do the opening. You need to find this little notch tab on the end of the envelope and simply pull that apart like so, and you'll find that it very neatly and cleanly opens. Then, again, someone with clean hands would come in, grasp that and remove it. This would now be disposed of, and this is taken for processing. Remember, try not to inadvertently expose excessively the sensitive plate on the side here. It's probably best to go ahead and place that into a dark box like this and transfer that over to the X-ray unit. Once you arrive at the digital processing station, you'll need to upload your patient's details on the patient management system which we use, which is called Titanium. So once you have the correct patient file, you'll need to go ahead and navigate to this little symbol here, which is the MyPax processing software. You'll now need to select that icon, and a second program will load on which we can process the image. Once the program has loaded, come here and select the template which we wish to take. In this instance, we're going to process a Bitewing radiograph. So we have Bitewing 2 already correctly on the screen. We're going to go ahead and now create a brand new template, which is this little square button here. We now need to turn on the processing software on the machine. We can do that by selecting this button here next to the red symbol, showing that the machine is currently idle. If you click on that symbol, you will notice it becomes active. And these two little green lights will light up on the machine, also indicating that we're now ready to process a plate. Now ready to process one of the exposed radiographs. We go ahead and retrieve that from our dark box, taking care not to unnecessarily expose it. We're going to go ahead and place it with the writing side facing towards us into this little slot here. It doesn't matter which of the two you use, as long as you have the appropriate plate mounted into here. We'll go ahead and position that there like so. You'll hear the machine start up, but you need to give it a little bit of a helping hand by very gently just nudging it down into place, and you'll watch as that plate slowly disappears now through the machine. We can show you what's happening there. It's disappeared down into here. And then back on the screen you'll see the image, a preview of the image shown first on this small window, followed by the actual radiograph. When finished, you'll see that the X-ray plate is spat out around this little receiving tray at the bottom. You're now ready to put that into a fresh envelope and leave it with the others in one of the boxes ready for use again. Back on this screen we can see the image that has been captured. We can go ahead and adjust it using some of the settings here, which your supervisors will help you with in the clinic. So in summary, we've now covered the equipment that we're using in the preclinical environment, as well as describing the main techniques: Bitewing radiographs, parallel periapical radiographs, and bisecting angle periapical radiographs. Remember that this is a training environment and that some of the things will differ in the live clinical environment. You do need to always, regardless if it's in the training or the live environment, adhere to radiation and infection control standards at all times. Thanks for joining us.